Recovering after your arthroscopic shoulder stabilisation with or without slap repair. This leaflet is designed to help you and your relative or carer have a better understanding of your injury, operation and recovery. It has been produced by the therapies team who will be responsible for guiding you through your rehabilitation programme. It is essential to remember that you have an active role in your own rehabilitation, both with and without the presence of a therapist. During your stay, if you and your relatives have any questions, please do not hesitate to ask a member of the team. What is an arthroscopic shoulder stabilisation? The shoulder is the most mobile joint in the body, and it can easily become unstable and dislocate after a direct accident or injury. Once it has dislocated, it can easily happen again because once the surrounding shoulder structures are damaged, they become susceptible to further dislocation, occasionally with only relatively minor injury. This surgery aims to reduce your shoulder pain and help increase stability and function of your shoulder joint by tightening and/or repairing the overstretched and damaged ligaments, cartilage and muscles to stabilise the shoulder. This operation can include removing the torn labrum, stitching the tear together, known as a slap repair, all reducing the likelihood of redislocation. Usually there are 3 small 1 cm incisions needed. The goal is that with increased stability you will regain your strength and movement so you can return to normal activities. What are the risks? In general, the risks of any operation relate to the anaesthesia and procedure itself. In most cases, you will have a general anaesthetic combined with local anaesthesia, which may be injected in or around the shoulder or around the nerves that supply the region. You will be able to discuss this with the anaesthetist before surgery, and he or she will identify the best method for you. Arthroscopic stabilisation surgery is commonly performed and is generally a safe procedure. Before suggesting the operation, your doctor will have considered that the benefits of the procedure outweigh any disadvantages. However, to make an informed decision and give your consent, you need to be aware of the possible side effects and risks or complications. Infection. There is around a 1% chance you may develop an infection. Signs of an infection include sudden worsening of pain, redness, swelling of the area, discharge from the wound, and if the area becomes hot to touch. Pain. It is usually painful for the first few weeks after surgery. It is recommended that you take pain medication regularly to begin with to keep the pain under control. If you require further medication, please visit your general practitioner or GP. You may find ice packs over the area helpful. Use a packet of frozen peas, placing a towel between your skin and the ice pack. Until it is healed, also use a plastic bag to protect the wound from getting wet whilst washing or icing. Leave on for 10 to 15 minutes at a time, and this can be repeated several times a day. Nerve or vessel injury. Bleeding. This is rarely an issue as this is a keyhole procedure. Blood clot, also known as a thrombosis. Stiffness. This is rarely permanent and usually improves over a 3 to 6 month period. And redislocation. How can I prepare? Smoking. If you smoke, you must try to stop or cut down as much as you can, as this will increase your risk of an infection and delay your healing. Shopping. Make sure you have completed a food shop prior to surgery and prepared some meals, as this will make things easier. Going home. Make sure you have arranged your journey home. You will need someone to collect you from day surgery and take you home. After surgery. Arthroscopic shoulder stabilisations have a protocol created by the orthopaedic surgeons. This guides the therapist to know what a patient can do without putting the operation at risk. You will be seen by a physiotherapist prior to discharge, who will give you some exercises to complete after your operation. You should complete these until you attend your outpatient's physiotherapy appointment, which may be carried out virtually. You will be able to go home on the same day as your procedure. Nurses will ensure you have eaten, the wound is okay, and your pain is under control. Dressing and wound care. After your surgery, you will be seen by the Community Orthopaedic Project in Essex, or COPE team, who will review the wound, remove any stitches, and progress your exercises as appropriate. If you do not live within their catchment area, you will be referred to the relevant local services. Be careful when washing, not to use soap or rub over the area. This will cause the dressing to peel off. Clinic review. You will be reviewed by your surgeon around 2 weeks after your operation. This may be carried out virtually. Outpatient physiotherapy. We will arrange your outpatient appointment at the trust or clinic closest to where you live. Your first appointment is likely to be within 2 weeks of your surgery. The physiotherapist will progress your exercise as per your protocol and assist you in your recovery. You will be required to attend a few physiotherapy appointments and continue your exercises regularly between sessions. Will I have a sling? You will be advised to wear a sling for the first 2 to 3 weeks after surgery. Your sling supports your arm, protects the surgical repair, and helps reduce pain. When wearing the sling, ensure your forearm is well supported and do not allow your hand to be lower than your elbow. You may remove your sling for exercises and personal care only. It must remain on for all other activities, including sleeping and walking. Sleeping. Lying on your back or on the opposite side will be most comfortable. A pillow can be used for additional support and can be placed by your side to prevent your arm falling to one side. Another alternative is to try sleeping sitting up with pillow support. Personal care. When washing, you may remove the sling if you ensure your arm is well supported under the elbow and kept close to the body. Alternatively, keeping the sling on, lean forward to complete a strip wash will allow you to wash under your arm. Loose clothing is usually the easiest to put on. When getting dressed, dress the operated arm first. When getting undressed, the operated arm comes out last. Will I get a medical certificate? Medical certificates will be provided on discharge if your recovery is likely to mean you will need to have some time off work. These will be issued for up to 2 weeks. If you require another certificate after this, you will need to contact your GP. When can I return to work and sports? This will be guided by the physiotherapist and surgeon and will depend on the type of work and activities you do. Usually, you can return to non-contact sports after 4 to 6 months and to contact sports around 9 months. You will need to inform your car insurance company that you have had surgery, as they may not cover any claims during your recovery period. Following discharge from hospital, contact your GP or attend the emergency department if you experience persistent pain, swelling, oozing or redness around the wound, fever or a high temperature, or a new, extremely painful swollen calf. Exercises. These are to be completed until physiotherapy guidance otherwise. Neck exercises. Start by sitting comfortably with your arms relaxed and your hands in your lap. Look up and then look down. Repeat this 5 times. Turn head to one side and then to the other side. Repeat 5 times. Tilt your head to one side and then the other. Repeat this 5 times. Shoulder shrugs. Shrug your shoulders up and forwards, then roll them down and back. Repeat this 10 times. Scapular setting. Keeping your arms relaxed with your hands in your lap and your elbows by your side, squeeze your shoulder blades together and down. Hold for 3 seconds and relax. Repeat 5 times. Elbow movements. Fully support your operated arm with your unoperated arm. Whilst completing these exercises, ensure to keep your elbow in front of your body. Support your operated arm with the opposite hand. Bend your elbow and hold for 3 seconds. Straighten your elbow and hold for 3 seconds. Repeat this 10 times. Hand and wrist movements. Start by resting your arm on a table or armrest. Remember to keep your elbow tucked into the side of your body. Move your wrist up and down. Repeat this 10 times. Make a fist and then spread your fingers. Repeat this 10 times. Please find useful contact numbers listed below. Thank you.